Hello everyone, welcome back to Kineticare. I'm Dr. Abeer Ali. In today's lecture, we will cover a complete overview of upper limb anatomy. This lecture is very important because it connects all the previous topics and helps you revise bones, muscles, nerves, vessels, and joints in a structured way. By the end of this lecture, you will have a clear understanding of how the upper limb functions as a unit. Introduction to upper limb. The upper limb is one of the most mobile parts of the human body. Unlike the lower limb, which is designed mainly for weight-bearing, the upper limb is specialized for movement and precision. It allows us to perform activities like writing, eating, lifting objects, and fine motor tasks. Anatomically, the upper limb is divided into four main regions: shoulder, arm, forearm, hand. Each region has its own bones, muscles, nerves, and functions. 2. Functional overview. The upper limb performs two major functions. First is positioning, which allows us to move the limb in space, for example, reaching for an object. Second is manipulation, which involves grasping, holding, and performing fine movements like writing or buttoning a shirt. These functions are possible due to the coordinated action of muscles, joints, and neural control. 3. Pectoral girdle, 6 to 9 minutes. The pectoral girdle connects the upper limb to the axial skeleton. It consists of two bones, clavicle, scapula. Its main functions are providing attachment to muscles, supporting the upper limb, allowing a wide range of motion. Unlike the pelvic girdle, it is not very rigid, which increases mobility. 4. Clavicle. The clavicle is a long, S-shaped bone. It acts like a strut between the sternum and the scapula. It has two ends. Medial end articulates with the sternum. Lateral end articulates with the scapula. Clinically, the clavicle is the most commonly fractured bone, especially in falls onto the shoulder. 5. Scapula. The scapula is a flat, triangular bone located on the posterior thoracic wall. It has several important features: spine, acromion, coracoid process, glenoid cavity. The glenoid cavity forms the socket of the shoulder joint, articulating with the head of the humerus. 6. Humerus. The humerus is the long bone of the arm. It consists of proximal end, head, shaft. Distal end. The head of the humerus articulates with the scapula at the shoulder joint, forming a ball and socket joint. Clinically, fractures of the surgical neck of the humerus may injure the axillary nerve, leading to deltoid muscle weakness. 7. Radius and ulna. The forearm contains two bones. The radius is located laterally and is involved in wrist joint movements. It plays a key role in pronation and supination. The ulna is located medially and forms the main structure of the elbow joint. The olecranon process of the ulna forms the tip of the elbow. Together, these bones allow rotation of the forearm, which is essential for hand positioning. 8. Bones of the hand. The hand consists of 27 bones, 8 carpals, 5 metacarpals, 14 phalanges. These bones are arranged in a way that allows both stability and flexibility, enabling precise hand movements. 9. Muscles of the upper limb. Muscles of the upper limb are grouped according to regions. In the shoulder region, the deltoid is the main abductor of the arm. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, stabilize the shoulder joint. In the arm, the anterior compartment contains flexors like biceps brachii and brachialis, while the posterior compartment contains the triceps brachii, which extends the elbow. In the forearm, the anterior compartment contains flexor muscles supplied mainly by the median nerve, while the posterior compartment contains extensor muscles supplied by the radial nerve. In the hand, muscles are divided into thenar, hypothenar, and interosseous groups, which control thumb, little finger, and fine finger movements. 10. Arterial supply. The arterial supply of the upper limb begins from the subclavian artery, which continues as the axillary artery, then the brachial artery. At the forearm, it divides into the radial and ulnar arteries, which supply the hand. 11. Venous drainage. The venous drainage includes superficial veins like the cephalic and basilic veins, and deep veins that accompany the arteries. These veins are important for intravenous access in clinical practice. 12. Nervous supply. The upper limb is supplied by the brachial plexus, formed by spinal nerves C5 to T1. The major terminal branches include musculocutaneous nerve, axillary nerve, radial nerve, median nerve, ulnar nerve. Each nerve supplies specific muscles and skin areas. 13. Joints of the upper limb. The upper limb includes several important joints: shoulder joint, ball and socket, highly mobile; elbow joint, hinge joint for flexion and extension; These joints allow a wide range of motion. 14. Clinical correlations. Common clinical conditions include clavicle fractures, Cole's fracture of the wrist drop due to radial nerve injury, claw hand due to ulnar nerve injury. These conditions help in understanding nerve and bone injuries in real life. Blank. To summarize, the upper limb is a highly coordinated system of bones, muscles, nerves, vessels, and joints that work together to perform complex movements. If you found this lecture helpful, please like the video, subscribe to the channel, and share it with your friends. Thank you for watching, and I'll see you in the next lecture.